crystals are small stones, mineralizations, mineralized debris, or sediment from the kidneys or bladder. Numerous crystals may form a gravity-dependent sediment line, as in the bladder seen in this 2-year-old intact English bulldog. If the crystals are dense enough, an acoustic shadow will be present. In ultrasound, the transducer is used to vigorously push or bounce against the abdomen over the bladder or gallbladder to cause small particles or debris to change positions. This is a form of ballottement. Loose debris or crystals often move around like particles in a snow globe, proving the particles are not part of the bladder wall. Ballottement is not violent enough to cause the patient harm or rupture the bladder. Elevating the patient's rear quarters will cause the crystals to shift position within the bladder. Sometimes crystals adhere to or are embedded in the bladder wall. This 7-year-old lab was seen for elevated liver values. Note the thickness of the bladder wall and stones embedded in the ventral wall. In this case, ballottement dislodges some stones or crystals, which are seen falling to the dorsal wall of the bladder. The cystitis and stones were an unexpected finding in this dog. A patient can also be allowed to stand to see the crystals or stones shift position. Is it always necessary to ballot a urinary bladder or gallbladder? This 10-year-old beagle was presented for elevated liver values. The bladder wall is thickened, indicating an unexpected cystitis, but the bladder seems to contain only urine. Ballottement reveals a large amount of sediment or small crystals that were unexpected. Stones or calculi can be small or large. Stones may be passed from the kidneys or may form from smaller crystals in the bladder. This large stone was seen in a 9-year-old dachshund presented for a heart murmur. Cystitis and the large stone were unexpected findings. Stones can occur singly or in multiple numbers, as seen in this 13-year-old Shih Tzu, presented for lethargy and diarrhea due to an intestinal tumor. Cystitis and the bladder stones were unexpected findings. Stones may be oval or rounded. Square or rectangular, or multifaceted. Be careful not to mistake a colon pressing into the bladder for a large stone inside of the bladder. Always look at the urinary bladder in 2 views. In a ventral midline transverse view, a stone will be inside of the bladder wall, while the descending colon will be outside of the bladder wall. When stones are seen on the dorsal bladder wall with the patient in dorsal recumbency, the urinary bladder can be rechecked with the patient in a standing position. Typically, stones are gravity dependent and will move to the ventral bladder wall. This 6-year-old cat was presented for chronic hematuria. The ultrasound shows cystitis and stones. The cat was placed on SD diet. When rechecked 3 months later, the cystitis and stones were resolved. In some cases, stones can be dissolved with medications or a special diet. In other cases, the stones must be surgically removed. Mucus appears as a non-sedimenting echogenic density within anechoic urine. Ballottement causes the mucus to swirl, but it still does not sediment. Mucus suggests irritation or inflammation somewhere in the urinary tract. This 6-year-old neutered basset had chronic hematuria from a large staghorn calculus in the right kidney. Suspended echogenic particles in the feline urinary bladder can be lipid droplets and are normal. Fat droplets are seen in the normal bladder of this 13-year-old rag doll presented with elevated liver values. Clots may be hyper or hypoechoic and do not shadow. They will not show color with color flow Doppler. Clots tend to show a fluctuant movement with ballottement and may change positions or break up. They are gravity dependent, but may be adhered to the bladder wall. They can be associated with urinary tract trauma, stones, infection, or neoplasia. Free gas in the urinary bladder will rise upward. With the patient in dorsal recumbency, the gas artifact will extend from the ventral bladder wall. If gas was not introduced into the bladder by cystocentesis or catheterization, the presence of gas artifact in the bladder suggests bacterial infection of the urinary tract. This 10-year-old Maltese has pyelonephritis of the right kidney, cystitis, bladder stones, and free gas in the bladder. Gas may be mixed with mucus to form small, non-sedimenting echogenic forms with distal gas artifact or reverberation. This 15-year-old lab was presented for a suspected mass of the spleen. Ultrasound revealed the splenic mass, multiple cysts of the left kidney, cystitis, bladder stones, and non-sedimenting mucus and gas in the bladder. Gas artifact in the wall of the urinary bladder is known as emphysematous bladder wall and may be seen in dogs with chronic cystitis or chronic diabetes mellitus. The gas is produced by bacteria growing within the bladder wall. The urinary bladder is not usually the source of an abdominal effusion unless the urinary tract is ruptured. In most cases of abdominal effusion, the bladder wall is intact and shows anechoic fluid inside and outside of the bladder. With effusion, the bladder wall may appear normal. The bladder wall can also appear thickened if cystitis or edema of the bladder wall is present. The prostate drains to the lumbar aortic, medial iliac, and hypogastric lymph nodes, which were discussed earlier in this DVD. Enlargement of any of these lymph nodes is a poor prognostic indicator when ultrasound lesions of the bladder or prostate are present. Lymph node enlargement suggests spread of infection or neoplasia to the lymph nodes. These lymph nodes are not specific to the urinary tract, but drain the rear quarters of the body.